The Prime Minister's new special panel on the coronavirus outbreak, or committee, held its first meeting this afternoon. Health Minister Patty Hajdu is, of course, on that committee. She joins us now. Hi, Minister. Nice to see you. Thanks for coming in.
Nice to see you, Vash.
I listened to your press conference, and one thing that certainly stuck out to me was that all the cases are so far associated with travel, and there is a high number. We've heard from Dr. Tam previously that she's even concerned about the high number associated with travel to Iran. Why isn't the government putting in place more travel restrictions, specifically as they affect Iran?
We actually have to put in more.
You put in an advisory.
Well, actually, no. We've mirrored the actions that we took on the province of Hubei. If you recall, there's an additional question for travelers from Hubei. Also, mandatory requirement to check in with public health within 24 hours, and advice to isolate at home and reach out to public health if in fact they're exhibiting any symptoms. So we knew that with the cases popping up from Iran, that there was significant community transmission in Iran, and took those actions late last week. They're in place now.
What about the idea of screening, traveler screening before they get on the planes? I know the U.S. has done things like that, especially, again, where Iran is concerned. Is that under consideration from your government?
I think what's really important to remember is that now I think we have 80 countries that have coronavirus exhibiting in their countries, some to greater degrees than others. And this is rapidly not becoming a border-contained sort of solution. We know that viruses don't know borders, and certainly we've been part of a global effort to try and contain the spread of virus from country to country. But as we see increased sustained transmission in countries all across the country, all across the globe, we have to continue to remember that our focus is going to increasingly be on our own domestic containment, our own efforts to delay.
I understand that, but I think that where the numbers in Canada are concerned, at least, and even when you look globally, yes, it is spread, of course, to many countries, 77 in total, I believe. But there are pockets where we're seeing it increasingly so, and actually even where there are concerns around the domestic reporting there, like Iran. And so, is there any consideration being put to increasing the level of screening, increasing the measures in place if there are those hot spots?
So what we know is the screening measures that we've selected actually have been highly effective, quite frankly, in terms of people understanding that they've come from an area of risk, being open and disclosing the fact that they've come from that area. The World Health Organization, as you recall, early on made recommendations that increasing border measures is not necessarily the best way to stop and contain the spread of the illness. And so we've been very judicious in how we apply this so that we actually get to the best result, which is understanding who is actually coming into Canada that potentially has contracted the virus, and supporting all international travelers with advice that if they're unsure or unwell about their health, that they should reach out to local public health, providing with them that information in appropriate ways for them.
You said you spoke to your American counterpart this morning. Was there any concern expressed to you vis-a-vis him about the measures that Canada is taking?
Not in the least. In fact, we've had a very good working relationship through the G7 ministers meeting that's happening weekly, and that's been very helpful for all of us to assess different measures that we've taken, the efficacy of those measures, and also a forward-looking approach in terms of collective action. Today, Secretary Azar and I had a conversation more profoundly about the North American situation. There is a North American pandemic plan, and we agreed to, reach into Mexico and offer a meeting with the Minister of Health in Mexico.
Congress decided today to put aside more than $8 billion to deal with what may come from this outbreak. Will Canada follow suit? Will your government be putting aside money?
Well, certainly, as you know, the Prime Minister has formed the special committee to build on the work that we've been doing around scenario planning. Early on, about a couple of months ago, our officials were tasked with the job to look at the potential scenarios that could unfold should we see an outbreak in a Canadian community, sustained transmission in a Canadian community, what that would mean, not just to the health and safety of Canadians, but also to the economic impact for Canadians, work disruptions in transportation, trade, or travel. And so those kinds of considerations are what that committee will be able to act on very quickly. We know that there is a global economic disruption, and that work continues to determine what's needed. But I will say, in terms of the U.S. funding, I will note that part of that money, a large part of that money, is actually to facilitate a public health response that they just simply don't have the capacity to actually mobilize very quickly. We're very fortunate in Canada. We have that already in place. And so the work that we've been doing is ensuring proper provinces and territories are well set up.
We do have a public health system in place, that's true, but we have heard some concerns from provinces, and those concerns could grow about the level of preparedness. Do they have the right equipment? Do they have enough of it? Are there enough ventilators in hospital? Is the federal government prepared to increase transfers to provinces for that?
We are prepared to support provinces in measures that they identify as gaps. So whether it is personal protective equipment that they can't acquire on their own and that they have run out of, whether it is ventilators because they've seen an increase of severe cases, whether it is human resources that we need to mobilize at a federal level to support provinces and territories, that's the work that's happening with Dr. Tam and her officials at that special committee, and that also is working at the provincial or at the ministerial level as well.
My understanding, though, is that that data just started being collected by provinces and transmitted to the federal government or Dr. Tam's office just last week. Why so late?
Well, I can't speak to the processes at the various provincial levels, but those conversations have been ongoing. We're very confident that they're doing the work they need to in order to assess their own particular situation. And there is a very clear delineation of roles for federal government if we see community transmission. And we're prepared to take the measures that are in the pandemic plan to support those provinces and territories if, for example, as I said, they run out of equipment or they run out of people. This is really an important responsibility of the federal government to convene to ensure that we provide a backstop to provinces.
Are you just waiting until that information arrives? Like, I'm just wondering if there's a lag here in figuring out what those needs might be.
Oh, no, not at all. And I'm sorry if I gave that impression. At the federal level, we're already planning about how we will acquire extra special equipment, how we will store that special equipment, how we will ensure that we can mobilize human resources and where we might find those human resources if we did see a shortage of healthcare workers, for example. So we have our own federal planning going on to determine how we will do that and how we'll be ready when provinces ask for that help.
You said that you expect in the press conference today this to reach the community level at some point. For Canadians who are watching tonight, what will they see? How will they know the federal government's response has changed when that point arrives? What will change?
I think, to be clear, if there's sustained community transmission or there's an outbreak in a community, actually it will be more, the response will be led by local public health authorities in partnership with provinces and territories. And those changes might include things like closing of schools. It might include cancellation of events that have been planned in the community. It might include a variety of different kinds of measures that are taken to, contain the spread of the illness. So whether that's isolating people at home who have contracted the virus so that there's a limit of spread. And at the federal level, we're there to support provinces and territories with the resources that they need and continue to communicate with Canadians the best way to protect their own health.
If that sustained community transmission occurs, at that point, is there an announcement Canadians can expect from the federal government that, okay, it's time to put aside X amount of money, it's time, you'll see this in the budget? When I take your point that it's a fluid situation, that obviously it's difficult to pinpoint what the impact will be specifically, but we are not getting any specifics from this committee or from anybody in the federal government about how prepared what kind of preparations are we set for?
Right. Well, to be fair, the committee had its first meeting today, so it was really important.
To be fair, it's been the coronavirus has been around for months.
And to be fair, we've been planning for scenarios for quite some time. So this is really about making sure that we have the ministerial level meeting that can actually operationalize the decisions that are going to happen quickly. Make no mistake, we are ready. We do have plans for Canadians that extend into severe scenarios where there is sustained outbreaks in a variety of communities. This committee allows us to action those decisions much more quickly.
And will we get those details soon, though, taking into consideration that today was the first meeting?
Well, certainly we'll have more to say, obviously, at budget time, but I certainly think that you can anticipate that if there is a need financially, the Prime Minister has been very clear that we'll be there for provinces and territories, and that will depend on the request. So, I think Minister Freeland said it well today. We're looking for the just right response. Obviously, we don't want to get ahead of ourselves and necessarily commit to actions that may not be necessary. We certainly don't want to have underpreparedness, but we think that we are well prepared and well situated to take those decisions as we need to.
Okay, I'll leave it there. Thank you, Minister Hajdu. Appreciate your time this evening.
Thank you very much.
Health Minister Patty Hajdu. Welcome back to Power and Politics with the Power Panel. Shachi Kurl, Amanda Alvaro, Tim Powers, Kathleen Monk, and Chris Hall. Amanda, I'll start with you. We were all just listening in. Well, I was asking the questions, but everyone else was listening in to Health Minister Patty Hajdu talking about corona. We had just been talking about coronavirus and its potential impact on the government, at least from an optics perspective. What were your impressions of what she said?
Well, I think that she's very solid on this issue, which is good news because I thought her parliamentary secretary was not as solid when he appeared on the show earlier. I think the message is so clear and has to be crystal clear on this one. The government is prepared. It is ready. It will come to the table with the necessary funds in the minor and the most severe scenarios. The federal government is dealing directly with the provinces in constant communication. And the Public Health Agency is also prepared, and that includes increasing lab capacity, looking at everything from, sorry, I'm going to look at my notes really quickly. Hospitals have surge capacity, supplies and ventilators are stocked. I think the most important thing is to convey the confidence to Canadians that there is a plan in place, that there will be funding and resources that will be made available, and that this government may be one of the most prepared governments in the world to deal with this crisis.
Chris, what do you think?
My overall impression is, yes, she exudes the confidence that you would need in this position to be able to tell Canadians that you are on top of the situation. That being said, it is hard to listen to her and understand that they're waiting to see when that first community spread is coming, because the message here is it is going to spread. It is coming. Mm-hmm. They are trying to delay it. They're trying to delay it because hospitals will be less crowded with flu patients and the like, and they're hoping that they can push it off into the future. But the fact of the matter for, I think, a lot of people who are listening is that you know it's coming. You know it's going to get worse. Why can't you tell me what you're going to do now to head that off?
There aren't a lot of specifics at this point.
That's the problem I think that they have to face here, is they really aren't setting out what they're prepared to do and why they're not doing it exactly at this moment.
It feels like, Tim, there's an acknowledgement of that in the creation of this committee. I think that the questions were increasing over the past week, just given the questions that the WHO was putting out there about the possibility of it becoming a pandemic. Everyone's kind of wondering, okay, what are we doing here? What are we doing here? And there were general answers, and we know that they're insisting that they're prepared. And I think most Canadians are fairly confident of that. But at the same time, there's nothing they say, oh, there's $1 million for this or anything.
Yeah,
like that.
It's really interesting. So we put out a poll on this today, and while Canadians score the government right now as doing as well as can be expected on this front and around the range of 78, the other bit of the data that's quite fascinating is Canadians think it's coming, but not for them yet. And if that starts to change, and people's anxiety about where the disease is going to go and it's going to affect them personally, that's going to heighten the pressure on the government to speak even more forcefully and clearly on what they're going to do. You had Don Davis, Pierre Poilievre, and Darren Fisher on earlier, and I think you've seen the opposition previewing where they're going to go on this, which isn't a bad preview on their part. Like, okay, it's coming. You can't run away from it. And I think all of us have experienced this in the last few days. Everywhere you go, somebody is talking about this.
It's the biggest topic of discussion.
And that when an issue becomes like that, you can be damn sure it's going to stick strongly to politicians, and they're going to be held account for everything that happens.
Listen, I find Minister Hadjo to be a very comforting force. I think she was a great pick, and particularly for the fact that she's facing this crisis right now. That said, she was effective at pushing back at Chris's question about, the U.S. is giving money, they've laid it on the line, and she countered with, well, we have the public health structures in place. What hasn't been answered by this government is the economic question that's more granular. The question about how will we help those workers who have stayed at home, who need to stay at home and quarantine, who are faced with the choice, I don't have the sick days to do, I can't afford to not go to work. Can the government look at EI measures, temporary EI measures like we've had in the past?
We had Minister Moore on yesterday saying, after minutes of a long time of asking, eventually came around to saying, yeah, that's something we are looking at, but would not commit. You're right.
And the second quick point would be the tourism industry and other industries that are going to be impacted by this. So those are the economic signals we need to hear. She pushed back effectively on the Trump payout and our public health structures, but she hasn't spoken to how they will support businesses and workers.
Shachi, what's your impression?
Well, and that's what it comes back to. So it's not just about, is the federal government releasing the funds, releasing the supplies necessary to close gaps in various communities where gaps exist. It is also on the handling of the economic side of it. And ultimately, it is very easy at the community level, at the public health authority level, at the provincial level to just kick that blame up and up and up. And ultimately, it will be this government that wears the success or the failure of how this is handled. And I think the minister did a good job today of communicating what she wanted to communicate, but ultimately there is a high level of anxiety, to Tim's point. We have polling that shows that confidence in the ability of public health authorities and basically community level medical clinics and hospitals to deal with an outbreak or a spread of the disease is really dependent on where you live. So if you're in BC, in Ontario, in Quebec, in those urban centers, you feel pretty good about it. In Atlantic Canada, more people lack confidence than have confidence. And the further you go in terms of remote communities, the more worried Canadians are. Can Ottawa get to those communities in a way that is timely and in a way that is helpful? And of course, yes, there is the economic piece of that as well.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.